Well, it's lovely to be here, and thank you, Public Health. I'm Colleen Boyle. I'm the director for the National Center on Birth Defects and Developmental Disabilities at CDC. Just delighted to be talking to you about public health nutrition. I know that all of you here are here today to help improve pregnancies and ensure healthy pregnancy outcomes. And as we just heard, nutrition is critical for healthy pregnancy, and what a woman consumes before and during pregnancy can really impact the health of her unborn child. Okay, so one of our public health successes that clearly demonstrates the importance of prenatal nutrition is the decrease in the prevalence of neurotube defects. Those are serious birth defects of the brain and spine in our country since our cereal grain supply was fortified with folic acid, which began in 1998. And you can see the fairly dramatic decrease. We now have every year 1,000 babies who are born healthy without these very challenging birth defects. And that's because we've enriched our cereal grain supply. So the bread you eat, the pasta that you have for dinner, the rice, it's all been enriched with folic acid. So clearly a wonderful success story. Birth defects, they are common, they are critical, and they are costly. We know in the United States, every 4.5 minutes, a baby is born with a serious birth defect. And that's one out of every 5 infant deaths are actually due to a birth defect. At CDC, we're focusing on birth defects research, prevention, and lifelong care. And today I'm going to be talking about really our investments in research, because research really is the key here. Through CDC's National Birth Defects Prevention Study, this is a very large study in 9 centers around the country, we've learned a lot of things about how to increase and lower the risk of, birth defects. And these include things like smoking, having a healthy weight prior to pregnancy, maternal conditions like diabetes, some medications that increase the risk, and diet quality, which is really the topic of today's briefing. So I'm going to just take a few minutes and walk you through what we see as the next success story to ensure that babies are born as healthy as possible. And I'm going to focus on 4 promising areas of research that will help us maximize the benefits of folic acid, which is a critical B vitamin, as well as optimal nutrition. And those areas are opportunities around corn masa flour fortification to help Hispanic women, unhealthy weight, diabetes, and medications, and some of the challenges with actually utilizing folic acid due to medications. So for the first one, we know, and actually if you looked on that slide that I presented, that graph in the beginning, you saw that Hispanic women or Hispanic babies are actually at greater risk, even though they've also showed an improvement over time through fortification. They have a greater risk for neurotube defects. We've been working with a consortium, including the March of Dimes, the Spina Bifida Association, to develop a food additive petition that's gone to the FDA to fortify corn masa flour with folic acid. That's really the one cereal grain that is actually not routinely fortified in the United States. And adding folic acid to corn masa flour would primarily reach Mexican American women and really help decrease the ethnic disparities in neurotube defects. So that petition, which was completed, was delivered to the FDA for their review, and it's currently under review. The second area I want to talk about is in obesity or healthy weight, trying to achieve a healthy weight. Our research has shown that being overweight, being obese, increases the risk of several different types of birth defects. These include congenital heart defects, which is the most common type of birth defects, and it actually affects 1 out of every 100 babies that are born in the United States, as well as spina bifida, which is a birth defect of the spine. So it's obviously difficult sometimes to achieve healthy weight prior to pregnancy. So what our research has been trying to do is looking at other strategies in which to lower the risk associated with being overweight or an obese. And we've learned more about the optimal amount of folate that a mother needs. So folate seems to be involved in the mechanism associated with increased risk of obesity and having a birth defect. So we're looking at that optimal folate level. We also know that better diet quality, we've all heard about the Mediterranean diet. Actually, better diet quality seems to actually lower the risk for birth defects. And another really important, because this is again focusing on prevention, another important aspect is the role of physical activity. So we're seeing in our research that just a little bit of exercise can actually lower that risk associated with unhealthy weight. So the third area I was going to talk about was our research. We've been doing research on groups of women who have higher risk of birth defects and how they may benefit from more targeted approaches to increase their folic acid intake. And one group is women who have diabetes, and we know that diabetes is on the increase in the United States, so this is becoming a much more important problem. And this is not gestational diabetes, so this is not diabetes that happens in pregnancy, but this is diabetes that happens outside of pregnancy, or what we sometimes call pre-gestational diabetes. So studies show that women who are in poor control of their diabetes in pregnancy have a much, much higher risk of having a child with a birth defect, as well as other serious health effects. And you can see a lot of them that are on this slide. But importantly, we also know that good control, both before and during pregnancy, reduces that risk of birth defects. Recently, we had some findings that came out that show that women who were diabetic, who also took a vitamin containing folic acid, may in fact lower their risk substantially of having a child with a birth defects. So again, even though diabetes is clearly something that should be in control during pregnancy, we do have some data to suggest that folic acid may in fact alter that pathway for the risk of birth defects. The other area I wanted to talk about was medications and birth defects. We know that some medications actually are what we call folate antagonists. That means that they interfere with how the body processes folic acid. And some of those medications are things that women have to take routinely during pregnancy, such as some types of antibiotics. So our research has shown that some antibiotics actually increase the risk of having an adverse pregnancy outcome, including birth defects. And the reason that happens is because that medication is actually interfering with the role that folate plays in normal development. So because physicians, women don't know the appropriate type of medication to take during pregnancy, we're actually starting a new initiative which is called the Treating for Two, or Safe Medication Use in Pregnancy. And what this initiative is to continue to do ongoing research to understand the role that medications play in the developing child in pregnancy, but also to provide that information in a form that's easy accessible to physicians as well as to women, to guide them to understand which is the most appropriate and safe medication to use in pregnancy. So what can we do? We're clearly trying to do more, and I hope I've illustrated for you some areas in which we are working on in terms of diet quality, the impact that nutrition and folic acid has on the risk of birth defects. But we know that we can do things now. So what we're also working on is really to take this information to women and use that information to prevent birth defects. And we're doing that through a collaboration with a number of partners. including Healthy Start, March Dimes, and other partners, through a national campaign which we call Show Your Love, which is a preconception health campaign, and it's really trying to deliver the message to women that they can really impact their pregnancies now through healthy eating, regular exercises, consulting their physician about any chronic conditions that they have, really prior to pregnancy. This whole idea of being prepared for pregnancy. So I wanted to just close with a story about why this is all important. This young man here, his name is Avery, and his mom, Megan, who've allowed me to tell very briefly their story. Megan learned during pregnancy that Avery actually had a condition called gastroschisis, which sounds very scary, and actually it is pretty scary. It's when the intestines are actually outside the body, and they develop that way in utero. Megan and her husband were told that Avery had a good chance, that there was a reasonable treatment. This is a serious defect, but there's a number of surgeries that actually can place the intestines back in the body. Unfortunately for Avery, after 3 months in the hospital and a number of surgeries, Avery did not make it. And his mom, Megan, who works with us, she doesn't work at CDC, but she works with us, to really try to understand why this condition called gastroschisis happened. It's increasing in the United States. It's increased twofold since the early 2000s. Avery's mom, Megan, really wanted to know, was it something that she did in pregnancy, or did she not take enough folic acid? Was it in fact that she wasn't eating the right foods, the healthy foods? So she really has challenged us at CDC, and really challenges all of us here in the room today, to help her and other families prevent birth defects. And really that's why we focus on researching risk factors for birth defects at CDC. So as we look to the future, the CDC scientists are really working hard to understand the next birth defects prevention success stories. We have a great success story within the context of folic acid and the prevention of neural tube defects. And we know, because of the research that has been invested over the last 10 to 15 years, that we have a number of opportunities to have as much impact as that we've had with folic acid and neural tube defects. So thank you very much. I appreciate the opportunity to provide you an update on what we're doing at CDC to help babies be born healthy, and particularly through the nutritional aspects. So thank you.